Good morning, everyone. Thank you so much for joining us for our December monthly stakeholder meeting. We wanted to make sure to still give the updates, even though we're getting very close to the holidays. So once again, today we'll have updates from Senior Deputy Commissioner on the data and activities that are ongoing across the state. Additional, some more information and reiteration about what communications are available. And we'll be taking questions as well. So throughout the presentation, if you've got questions, feel free to put them into the chat and we can track those for following the information piece. Otherwise, we can also take questions once we turn to Q&A. So either way, we can track it throughout, but we will have time at the end to answer some. So I think with that, I can go ahead and turn it over to you, Senior Deputy Commissioner, and thank you so much.
Thank you, Helen. Welcome, everyone, to our last stakeholder meeting of 2023. It's really hard to believe that we are now 8 months in and closing out 2023 for our unwinding of the public health emergency. For those of you who join us every month, thank you for attending. If you're new, welcome. We'll continue to have these throughout the rest of the unwinding period, so definitely stay tuned or catch it on repeat on our website as they get posted following our presentation. So while I'm presenting, I turn off my camera because I'm looking at a different monitor. But I'll come back on when I've concluded the PowerPoint. Thank you. Okay, let's get into it. Why we're here, just always a reminder, we are unwinding the public health emergency. During the PHE, as we call it, we maintain continuous enrollment for Medicaid members. And during those 3 years, that ended on March 31st, and states were required under federal law to begin their renewals. We do have a lot of flexibilities in place that we'll talk about as we go through the unwinding period, but that's what we're talking about today. We do not have any new flexibilities we've implemented. This is just a reminder of a few of the ones that are more recent, but also discussed in previous stakeholder meetings. I do want to emphasize the December renewals. We are redistributing the majority of the renewals, but you are going to still see both approvals and terminations and renewals in December. And the reason for that is we've maintained the renewal in December if it's aligned to another program like SNAP or TANF. The reason for that is then the eligibility worker only has to process that case once. So we didn't want to separate out the Medicaid renewal from the other program. So those will still continue to be processed in December, and we may still see terminations as a result of that. We are also allowing what we call an ex parte or passive renewal. So what we did is in November, we attempted for renewals that we kept in December. We attempted a passive renewal. So we went out and checked the trusted data sources, and if we were able to verify somebody's eligibility through that way, we went ahead and renewed them and kept them in a December renewal. Anybody who could not pass that passive renewal ex parte process that we normally would have then sent a request for information and move into what we call an active renewal, we ended up redistributing those cases so they were not going to lose their eligibility in December. So their renewal date would be moved. This is in the background, so individuals would not have been notified that they had a December renewal that was processed. They'll just get notification that they've got a new renewal date based on the redistribution. But we are continuing extensions. So if someone is unable and is in long-term care and a waiver member and has not responded to a notice, then we can extend them up to 3 months to give them that additional time to submit that response. And it allows us to continue outreach efforts around those individuals. If they come upon their 3-month extension and still have not responded, they will procedurally terminate as a result for not responding to a notice. For all others, the non-long-term care, non-waiver members, we can extend for up to 1 month. So we continue to do that as we move forward in the unwinding. And also just a reminder, we did receive approval for flexibility to go ahead and grant a 12-month continuous coverage to children under age 19. This started in October, so children, as their renewal month comes up, are already being pushed out 12 months. The current rules on continuous coverage for children apply, and that means if they turn 19, if they move out of state, a parent or guardian could request that they be disenrolled. All those still apply. So you would still see some children terminate, but we have greatly reduced the number of children. We already had a very, very low rate of children terminations compared to other states because of all of our strategies, but now you're going to see very low numbers for children. A lot of folks are always interested in home and community-based, the 1915C waiver members, and we are currently extending those. We did file in November all amendments to all 6 of our home and community-based waivers. Those are pending with CMS, and while they're pending, they are still in effect. Once the approval comes from CMS for each of the waivers, the flexibilities that we amended and added to those waivers will then become permanent and part of the waiver. We do track this information a little separately, so you can check our website for all of the updates that are specific to HCB. Not unanticipated. We are seeing a decline in overall enrollment. You know, we were at our highest in April. So we did know that we had folks on our that were part of our population that were no longer eligible, and so you're seeing the natural decline that's coming with as we do determinations over the course of the unwinding period. So not too surprising. So every month we file with CMS a monthly report. We do post those on our website. So this is the running, you know, we concluded November, we're still in December, so that those are still under processing, and we'll post that on or before January 8th. So you can see the trend. We have a much smaller number in November as we attempt to redistribute cases through the unwinding to help with the workload for our sister agency, the Department for Community-Based Services, who do the eligibility determinations. We know there was a significant backlog. The good news is that they have worked very hard to reduce that, and in fact, I believe have pretty much been able to erase the backlog and are able to keep tasks and processing more current. Renewals had an impact on new applications as well, so we were seeing long processing times and delays for both renewals and new applications that we hope with the strategies and flexibilities we put into place November and December, we hope to see everyone getting caught up on their processing times. The column of extended are those that I had mentioned where at the end of the month, if the person was due for renewal and did not respond to notice, we were able to extend them. So you see how that accumulates. But once that extension ends or is exhausted, the individual does terminate if they've not responded. We are also keeping folks on. There's a pending column here. Those are the folks that they have submitted something and they cross over the renewal date. And if it's pending state action, they get extended until the state takes action. So each month we do see pending activities and cases as a result of that. But we are seeing an increasing trend in being able to passively renew folks and put them in the approval column. That's always good to see. For those of you who may not be aware, we started a demographic report. Our first report came out in September. Those are also posted on our website. So here's looking at what happened in November. We're tracking race and ethnicity as well as gender and age group. In more detail in the report by county, we are also tracking approvals and terminations. So you can go and look to see in each county at the county level what the numbers look like. Here you see we have two reflections of the state. We had so little cases in November that it's skewed a little bit, but no surprise. Our largest numbers are always in Jefferson County, one of our largest counties. But looking back at the children, as you can see, we've got 14 under the age of, up to the age of 18. And again, those would be because of some actual determination of ineligibility or a request to disenroll someone. But they're approved, so we will move on. So we're also tracking reinstatements. By reinstatement, we mean that if someone is terminated, they have up to 90 days to respond if they're procedurally terminated, and that is due to not responding to a notice. They have up to 90 days to respond, to go back and provide the information that we need, and they should be automatically reinstated if determined eligible back to their termination date. So there's no actual gap in coverage. This is something we're really continue to outreach on because we do want folks to know, especially providers, that if someone comes in and they have a Medicaid member who just recently terminated, within this 90-day period, encouraging them to go out and take action so that if they are eligible, they can have that coverage available to them and that there's no gap. So this is something that we're tracking. For November, as you see the very last box there, 1,320. That's just through the first 18 days of December where folks were procedurally terminated, but have reached out and able to get reinstated. So tracking October and September still as the 90-day period is still available to them. We always try to focus on a couple of outreach priorities. They haven't really changed very much throughout the unwinding period. The number one there is just encouraging members to respond to a notice, even if they think they're not eligible. Early on, we wanted to make sure that folks understood that even if the adult wasn't eligible, the child may be, because there's a higher federal poverty level limit for children. Of course, now that we're suspending child renewals and automatically granting them 12 months, that's not as important. But for adults, we really do want to make sure that they receive an actual determination. So we're still encouraging everyone to respond to that notice so that an actual determination can be made. I mentioned reinstatement. So again, we're very much trying to communicate around this with providers and others who support members to make sure they know that there's that 90-day period available to them. This one is new. The third one, help members who lose categorical eligibility understand the steps to take to continue coverage. So by that, I mean, there are a lot of individuals who are Medicaid eligible because they're in a certain category. For example, foster children. If a child is in foster care, they're automatically granted Medicaid eligibility. Another is Social Security income. So if someone's receiving SSI, they also are Medicaid eligible. These folks lose their eligibility in that category if that changes. So if they lose SSI, then they're not eligible for Medicaid for that reason. However, they could be eligible in another type of assistance or reason for another reason. So right now we're really focusing our efforts on making sure that individuals that are in these situations understand what steps to take to make sure that we can still take a look at their situation and see if maybe they're eligible for something else. So you might see that we are doing a lot of communication around the SSI population so that they we can work with them on seeing if they are eligible for another type of assistance. And then we know people are ineligible, but what we want to make sure is they remain covered. So we're really trying to get a glimpse into whether or not they have employer-sponsored insurance, or if they qualify for a qualified health plan and they're eligible for that advanced premium tax credit, so APTC, that makes that qualified health plan more affordable. So if they've lost Medicaid eligibility and they're eligible for that APTC, we really want to support them in going out and choosing a QHP plan and making sure that there's no gap in their coverage. So working on that as well. Lots of outreach. I've talked about from the beginning of Unwinding the state. So we outreach to members, regardless if they're in managed care or fee for service. We outreach to them about 3 times prior to the renewal date. So we notify them about 90 days prior to the renewal date. We send them another communication about 60 days prior, and then we communicate again about 15 days prior. That is the minimum of what we do. And by communicate, I mean we try to send a text or an email if we have one on file. So whatever modes of communication we have, we try to utilize in order to let folks know that they're going through a renewal. We are also, depending on when somebody might respond, if they haven't through that renewal period, which happens, they'll receive their notice if they're going through an active renewal at least 45 days prior to the renewal date. We will continue to outreach to them. We pull a weekly list of folks who we haven't received a response from, and we try to find ways to reach them so they know what's happening. I know some of the things the managed care organizations are doing is working with providers. They're working with their primary care providers, and for members that are on their panel, making sure they're aware that the member is up for renewal and assisting with trying to reach that member where they are. So again, lots of outreach that's going on to members, and we're hoping that that's at least encouraging folks to take action when they need to. I think some of the things that is very difficult to truly understand is, where are they going? Do they already have coverage and that's why they're not responding? We do monitor third-party liability that's on file for these members. So if somebody, for example, is being terminated on December 31st because they didn't respond to a notice, although that's a bad example because we've redistributed them. But if they did not respond and they get terminated, we are looking at whether or not they had third-party liability on file, because maybe that's through an employer. It's comprehensive insurance that we're looking at, not like just a dental or vision plan. So we are monitoring that. And we do see, depends on the month, but we do see about 40% of those that are procedurally terminated do have some other coverage on file with us. So that's, or hoping that that means that they don't have a gap in coverage. We're going to talk a little about the communication materials that we have available. There's a lot. If you go out to our website, we've been constantly adding new information or tweaking current information to what we think the message needs to be. We appreciate a lot of providers and stakeholders, advocates have been very helpful in helping us create the flyers and other communications materials that are out there to try to reach folks where they are and help them understand what's happening. One of the newest ones that we have out there is about ID proofing. If a member goes and tries to create an account on Connect, which is what we've been encouraging them to do, because that's a really easy way to keep your information updated. It's a quicker and easier way to process a renewal for a member to upload their information to it. You can do it on your mobile phone. But if they're having trouble creating that account because of an ID proofing issue, we created this tip sheet to try to help members navigate that, because we understand that that can sometimes be a challenge. And then I mentioned reinstatements. You see we have a reinstatement flyer. So if you are somebody who works with Medicaid members, whether it's a provider or an advocate or some other stakeholder, and you run across somebody, at least this is something you could potentially hand to them and help them understand how to navigate that. So lots of materials on our website. And we're always asking if there's a gap, if there's a need for something else, we're happy to work on that and get that posted. Even this late into the unwinding period, we'd be happy to do that. We always include this information just so everyone has it really easily available on all the ways that someone can respond to a notice that they get. So this is a request for information or a renewal packet. So one of those, the self-service portal, is what I was talking about on Connect, where the member can have an account and go in and update information through that and upload any information that's requested. They can fax or mail it. They can call in some verifications. They can call in to DCBS or their Connect line or the Connect line. And then our wonderful connectors and insurance agents across the state who are able to assist members with both renewals and applications. There's a find a connector or agent or DCBS local office way to do that on our website. Just for providers, we did create 2 reports, and just a reminder that out on the Kentucky Health Net, which is the system that's available to members to verify eligibility, the redetermination date was added, so it is on there. Some members don't have a redetermination date if they're not subject to a renewal. Those categorically eligible individuals I mentioned, they maintain eligibility as long as they're in that category, so they may not have a renewal date on there. But if it is somebody who is subject to a renewal, then you'll see that redetermination date on there. And then for those providers who serve our long-term care and 1915C members in the Kentucky Level of Care System clocks, there is also an ability to pull down a report that shows when a member's renewal date. So for their patients, they're able to really kind of forecast ahead in the months ahead how many of their patients may be going through a renewal. There's a lot of support for connectors out there. We have several meetings, so if you're a connector, make sure that you're, hopefully taking advantage of those opportunities to interact with the department about cases. There's a case escalation that is specific to connectors and agents. So if you're not one of those, you won't be able to access the link to the process, but we do have an escalation process, and we always encourage our connectors and insurance agents to please utilize that escalation, especially for dire needs. So I mentioned qualified health plan, and we are in open enrollment now through January 16th. So that means anybody could make a change or enroll in a qualified health plan during this time. However, there is still a special enrollment period for Medicaid. So if you lose your Medicaid coverage at any time between there, it shows you from March 31st of 2023 through July 31st of 2024, at any time during that period of time that a Medicaid member has lost eligibility for Medicaid, they can do an unwinding special enrollment. It is just, I think, a box that you check to attest that you lost your Medicaid eligibility during this period of time, and that's all you need to do. You don't have to submit anything to show us approval, show us the termination, and that's because we have an integrated system, which I think serves our members and Kentuckians for this very reason. There are now, during qualified health plan enrollment, Saturday hours available. You'll see there from 8 to 5 as part of the QHP enrollment window. And as we've seen Medicaid enrollment start to decline, we have been seeing a really nice, constant, steady enrollment in qualified health plans as folks move over. We'd like to see more. We're still seeing quite a gap between what our system can identify as someone who is no longer Medicaid eligible, but is QHP and premium tax credit eligible, not enroll. So that's one of our outreach priorities, is to try to get those folks to take action to enroll. So still would like to see a very steady increase in those enrollments. And this is just a snapshot of what 2023 looked like, 61,909. And for 2024, we already have a larger number, 68,673. So good to see that's growing. The other thing to mention about there is the tax credit, but there's also a cost sharing assistance available depending on somebody's income. So really not just making the premiums no cost or low cost. It is possible that they could also have some financial assistance around their cost sharing. We always hear about scams. So we've been, knock on wood, fairly lucky here, I think, in Kentucky, that we haven't seen a lot of Medicaid unwinding scams. And also, we've not really seen any highly reported QHP scams, QHP open enrollment scams. But just to make sure everyone knows what to look for, I think the big thing is that making sure people understand that there are 4 insurance companies that are on the exchange. So if if someone's calling and is not from one of these, then they it likely could be a scam. If they ask for a bank account, ask you to wire money, ask about your health information, if they ask about a pre-existing condition, which is not permitted for enrollment in a qualified health plan, then that also is likely a scam. Department of Insurance is who monitors that. So if you do know somebody that has potentially been scammed, we are encouraging folks to report that to the Department of Insurance. And just a snapshot of our unwinding website and all the information that's available. Like I said, our monthly reports, past stakeholder meetings, frequently asked questions, lots of member and provider information. So please feel free to go out and navigate that. And then this is my always plug for asking you to maybe like or follow one of our social media accounts, Facebook, Twitter, and Instagram. You don't have to do all three, as we generally put the same information across all three. So just if you choose one and like or follow us, that would be great. And these stakeholder meetings will continue through the unwinding period, though Thursday at 11 a.m. If you're unable to be with us live, again, that's recorded and posted. And then just a reminder, we do have a lot of reports out there and available for folks: the CMS monthly report, the monthly demographic report, and the providers clock and Kentucky Health Net information. One last thing I want to mention about the CMS monthly report is that while the current report will continue, it's due on the 8th of the month following the month of renewal. So for December, that's January 8th. CMS recently changed requirements to also require states to go back and report pending. So that pending bucket, that column that I showed you, we will now be going back, and they want us to report any activity on those pending within 3 months following the month of renewal. So we are working on right now, by the end of December, we are required to update May, June, July, and August reports. And that has to be filed with CMS by December 29th. So we're working on those right now, and you will see that we'll start posting updated monthly reports to be in compliance with that. Following that, then there's just a regular cadence where we have to go back and, after the 90 days, file an updated report for that month. So by that, I mean, so for September, we have to file that by January 15th, and it'll be a rolling requirement. So so we'll be reporting well into the summer for us to be in compliance with reporting the pending updated. So I'm going to stop sharing. I'll turn my video on, and I'm happy to take questions.
Thanks, Veronica. That was extremely helpful. We got a question coming in when member or participants registered, and one of them was about, I believe it was from a healthcare system perspective, just wondering if you could sort of expand on the fact that cases are pending and why they may be pending, and what the state is doing. As you gave the update that we're tracking those pending cases and the resolutions, but what does it sort of mean for either the hospital side or the member side to have a case pending?
It does mean that there's been a task created, and DCBS, or the eligibility worker, needs to move to that and get that processed. We still have pending cases from May, very, very few, but there are still. And some of that is because we are working through the documentation. I think we're really just trying to be very member friendly when it comes to that. So if there is a case pending that long, the member's eligibility should still be pending, because that's one of our flexibilities. And we have been encouraging everyone that if they see that somebody has a pending task or a pending case, that we're supposed to maintain eligibility during that period of time. So definitely that should be escalated if that person's not maintaining eligibility while the state has a pending action. Again, I think, as I mentioned, as we have done a lot to try to reduce the overall workload by redistributing cases, we are seeing things get quicker, processing get quicker. But if it is pending for more than 90 days, it should be escalated, and so that we can take a look as to what's happening with it.
All right, thank you. We did have a question come into the chat about any updates regarding waivers, and specifically about telehealth being able to be billed, and will there be a process for ABI waivers providers to switch to state Medicaid plan? I'm going to go ahead and put a link to the waiver one-pager into the chat. And also that has information about the telehealth regulations that were formally put in place during the unwinding that can be helpful too. But anything else to share with that?
Yeah, just that I know there's been a lot of confusion around that. We put most of the telehealth flexibility, if not all of it, permanently into place by amending our regulation back in 2021. And some of that was in response to legislation. But so a lot of the telehealth flexibilities are permanent in that regulation. And then I know there were some additional ones for some of the how home and community-based providers operated that are a little different than normal, and are likely not encompassed in that. But as Helen mentioned, we've tried to create some communications around what that looks like now. Just a reminder, the flexibilities that we had during the public health emergency have been extended based on our amended waivers. So there should not be any change in the way that you're currently operating, but I believe there's a contact number, if you need to further discuss this with the department. I understand that. Just reach out, and we're happy to take one-on-one cases and discuss those situations.
Wonderful, thank you. The last question that we got in from the registrations that I wanted to just flag, and you did allude to it and gave the information during the session, but just want to reiterate, could you run through sort of the timeline and process that a member would be experiencing and the amount of time that they have to submit the renewals? I know it's already been said, but just no harm in repeating.
Absolutely. And I want to actually start with the fact that we do 90 days prior to the renewal date. We will send them a communication. So we will try to text or email them to let them know what their renewal date is. We get a lot of folks have never gone through a renewal before, or they've forgotten. Even if they've been a member prior to the public health emergency, they've probably have just gotten used to not having to do that on an annual basis. So really, we're trying to reach them far in advance so that they can keep an eye out. That's only as effective as the information we have available in our system. So we have been since the start of and prior to the start of the unwinding, just encouraging members to keep their information updated. So another piece that we've been encouraging providers, that if somebody comes in and they're updating their information with you, ask the question, well, did you also update your information with the state, so that we're also getting updated. But so 90 days prior. And then at the beginning of the month before their renewal, so for example, a December renewal, in early November, we'll try that passive renewal and try to update them based on the information that we can find out there with our trusted data sources. So income, assets, we have a lot of resources, a lot of databases out there that we go out and check. And if we're able to do that and they can be passively renewed, then sometime around the second week of November, they'll get a letter issued that says you've been renewed. Here's your notice of eligibility. If they can't pass that, then also in that second week, they'll get either a request for information to verify something, or for those who have the kind of the more complex eligibility determinations, such as long-term care or 1915C, it really is hard to go out there and verify all the information that's necessary. So they usually get a renewal packet, and that renewal packet, like the request for information, will show what information we have available to us, and what information we need. So we try to the extent that we can to make it easy to understand what it is exactly that we need. So they're about mid-November or mid the month before their renewal, they should be receiving a written notice that tells them what it is. They either were passively renewed or this is the information we need. Those written notices are also in somebody's Connect account. So if somebody does have a self-service portal Connect account, that gets uploaded to the account too, which is also another reason why we always encourage, we have been encouraging folks to create that account, because you don't have to worry about the mail in that situation. So then they'll get that written notice. If they've not responded, if our system sees they've not responded by the 15th of the month, they will get another notice to say, we've not heard from you and you're terminating at the end of the month. So a couple of different opportunities to receive communication, but what the member needs to do is respond, by that end date. We don't encourage this, but that means that even on their end date, so December 31st, they could anytime before midnight go online and submit that on the portal. But it always makes it a challenge to make sure that we're extending folks when we have information pending processing if they wait to the last minute. Then again, they get their eligibility extended if there is something pending. They will also be extended if we haven't received anything. So let's talk about somebody who didn't respond. They will then get another notice saying that their eligibility is being extended as part of the flexibility. And so for long-term care and 1915C waivers, that could be up to 3 months past that renewal date. And for other members who didn't respond, that could be a month after their renewal date. We hear, and let me say that no system is perfect, or it's like a human. No human is perfect. So I think that's why it's really important and why we talk about escalating dire needs. If you find somebody who wasn't extended and they should have been, to reach out so we can get their eligibility put back on. The mail is the mail. Things unfortunately get lost, or people move or change and don't notify us. We do, before we send any mail out, we check the National Change of Address database. That's one of our ways of trying to keep the contact information updated, but not everybody uses that. So it's only as good as somebody who actually reports a change. So maybe they reported the change to the post office, but didn't report it to us. That's one way we can catch that. So, we hear that, nope, I didn't get my notice. Or just recently I was talking to some providers and they said, we're seeing requests for information come after the due date. What we ask for people to do is to let us know. We have to have examples to be able to trace it through the system to see what might be happening. And why is that happening? Did something, that allows us to even go back and look at the mail house. Did something happen with the mail? And sending it out. So we're really trying to be very member centric in this and do things that is in the best interest of the member and to help the member navigate this, really difficult process. So again, plenty of communication going out throughout the renewal period, 90, about 60 to 45 days prior to renewal date, and then 15 days prior to renewal date.
Great, thank you. Yeah, there's a lot of messages going out, but that's sort of the general trend, and there's all the communication resources available online to help that as well.
Yeah, we did. We even have had members, be upset at the number of times that we're communicating with them. They're like, "Don't call me, don't call me."
Yeah.
But just trying to help people.
Great. So a question did come into the chat specifically about how pregnancy and the postpartum period impact the renewal timeframe for members that applies to.
Okay, so that is sort of an interesting issue, because so if somebody is within their 12 months postpartum period, we are not permitted to just enroll them. So if somebody is coming up for renewal and they're in that 12-month postpartum, they shouldn't be going through a renewal. So if you all find situations where something just doesn't seem right, we ask that you escalate that to us so we can take a look at it. But the 12-month postpartum is a guaranteed continuous coverage.
Wonderful. Thank you. That's helpful. Are there any other questions from those in the audience today? I haven't seen any others come through, but want to make sure to leave a bit of room to let those straggle in. Okay. So I am going to go ahead and put the link to the Medicaid the PHE unwinding website that we have in there. It's coming in as red. That was unintentional, but it's okay. Maybe it's just the holiday theme. It's
or
coming
Christmas.
in as red. Yeah, absolutely. So there's a lot of information there. There's links to upcoming sessions. There's links to our past sessions if you would like to listen backwards or listen to previous sessions we've held. The reports Veronica mentioned are there, and we'll continue to update them and house everything there. And continue to kind of check back for resources. We are available for any requests for specific resources. There's avenues for flagging that for our team. And we really do appreciate your partnership. Please feel free to take any of those materials and share them with your clients or patients or anybody that's coming in your door. We encourage everybody to continue to get this message out, and that's the best way to partner with us right now, I think. So I think at this point, no questions have come in while I was saying that information. So a reminder that we will be putting up these slides and this recording onto that website. May take us, we got to download, edit, and get it up around the holidays. So look for that in the next few weeks or so. And then we will have another session again in January to give additional updates. But appreciate everybody that came and joined us today. Extremely appreciate Senior Deputy Commissioner taking time out of your day to provide these updates to this group. And I wish everybody happy holidays and a happy new year. Very much looking forward to continuing this work in 2024 and, wrapping up the unwinding the unwinding, returning back to normal, all of the things that 2024 will bring. So thank you everyone for taking time this morning.
Goodbye.
Bye.